Hello, my name is Chloe Picot-Jacobs. I'm a licensed clinical social worker supervisor and therapist with Austin Anxiety and OCD specialist. Thank you so much for joining virtually for this presentation on managing parental stress. This was created with parents of children with anxiety and or OCD in mind, but there are some strategies and some information on stress that hopefully will be useful to any parent. But we did create this with OCD Awareness Week in mind, thinking about the unique challenges that are faced by those caregivers of kids with OCD and anxiety. So this is just a little snapshot of our agenda for today. We're going to try to cover quite a bit in a fairly short amount of time. First, we'll talk about caregiver stress, what that looks like, how to know if you are getting too stressed. And then I'll talk about some common challenges faced by parents of kids with anxiety and OCD that can be pretty unique. Then we'll dive into some coping strategies, some that are longer term strategies, as well as some coping tools for in the moment stress. And finally, a few resources that might be helpful to you all. So first, let's talk about caregiver stress. What do we mean when we talk about stress exactly? So, stress in and of itself is not a bad thing. It can actually be really healthy and useful to us. When we say stress, it's really just the body's natural response to pressures. And those pressures can be internal or external. And we can experience stress in a lot of different ways. Some people feel their stress more physically. So things like muscle tension, headaches, upset stomach. And then others might notice that their cognitive processes are more impacted. So they might notice negative thinking, some thought traps like thinking black and white, all or nothing sorts of thoughts come up the more stressed we are, less flexibility in our thinking, the more stressed we are. And of course, stress can impact our emotions too. We can feel overwhelmed, upset, more irritable. So, stress can impact our whole system. And as I mentioned, there can be external factors that make us stressed, like family responsibilities, project due at work, something that we've seen on the news, those sorts of things that happen really in our context. And then there are some internal factors like our temperament that we were just born with, or our personal histories, our own sensitivities. So, something that can be very stressful for one person might not create a stress response at all in someone else, and that is normal. There are some things, both internal and external, that we have some control over, things that we can work on or shift so that we feel less of a stress response, but some things are out of our control, which I know in and of itself can be stressful, but just something to acknowledge that sometimes life just is stressful and we might not have too much control over it. Okay, so this visual gives a little look at different levels of stress. So as I mentioned, stress can actually be a helper for us. A bit of stress can actually help us reach our optimal performance, give us that sense of flow when we're doing something at home or at work. It can give us some energy boosts and help us stay focused and allow us to really prioritize what's important. If we feel this jolt of stress, we might realize, ooh, something needs my attention. Let me pause what I'm doing and shift my attention where it really needs to go. So again, not a negative thing in and of itself. At the same time, when we experience too high a level of stress, especially if it's persistent, you don't get a chance to decompress, rest for a long time, and you've been in a state of elevated stress for a long time, can actually experience distress. So that's at the far end of this image where you might notice exhaustion, being totally burnt out, feeling like you're at your wits' end, you can't give anymore. I mean, it can impact our physical health too. Too much stress actually impacts our immune system. So you might notice yourself getting sick more frequently, or if you do catch a cold, feeling like your body has a bigger response to it than usual, has a harder time recovering. So there are a lot of physical impacts of stress. Our body will really let us know that we are taking on too much. Some signs to look for of excessive stress, and this is particular to adults. There is some overlap with stress signs in kids, but they have some others that adults don't have to, and vice versa. So this is really thinking about yourself and other adults in your life. Significant sleep disruption is a big one. So that can look like nightmares, difficulty falling asleep, difficulty staying asleep. If you notice, you start to wake up several times at night and you're not sure why, and that's disrupting your sleep patterns, that can be a sign of excessive stress. A noticeable change in appetite. So thinking about what's typical for you, setting aside, illness, a new exercise routine, something like that. If you notice that your appetite is really low, nothing sounds good, you can kind of feel in your body that you're hungry, but your appetite actually isn't there, that can be a sign of too much stress. And the opposite is true as well. So feeling kind of insatiably hungry, like you have this urge to eat, you don't really feel full or satiated, that can also be a sign of too much stress. If you find yourself disconnecting from the people in your life, not feeling like you have the energy to open up, be there for people, spend time with folks like you usually do, including your kids, that can be a sign of stress, as well as if you feel disconnected from activities you used to enjoy, maybe hobbies or taking walks, spending time with pets, those sorts of things. Those things don't bring you joy or energy like they used to. That can also be a result of too much stress. A persistent feeling of exhaustion. So feeling really fatigued, like no matter how much rest you get, even if you do get more sleep in the night or manage to squeeze in a nap, you still feel totally depleted. That can be due to stress as well. And then an inability to rest. So again, when you do get those brief moments of precious downtime, you feel like your body is still buzzing, your thoughts are racing. It can be a sign that your body has been in a state of stress for so long that even when you do get that break you've been looking forward to, you actually can't settle because you're so heightened. It takes a long time to actually be able to relax or let go of that stress. Overwhelmingly strong emotions are common too. So you might feel really sad or really angry, overwhelmed, irritable. And again, it's because stress impacts our whole system, our brains, our bodies, our emotions. Those are all tied up together. So if you're feeling really big emotions or feel like maybe you're crying way more easily than you normally do, that can be a sign of excess stress. And then finally, thoughts that are hopeless or unsafe, thoughts of self-harm, of giving up, etc. Those are big red flags that you really need and deserve some support because you might have been handling a lot for a long time. There is also an impact on the whole family system when parents are stressed. There can be relationship strain between family members. So feeling disconnected or like it takes a lot of energy to engage with your family members. And that's your kids as well as your partner, maybe siblings and your own parents as well. Feeling like maybe you have less patience than you used to for family members. A negative perception of yourself, especially as in your role as a parent, as well as a negative perception of your kids. If this happens, please try not to beat yourselves up about it. It's really common when we're feeling stressed for our brains to veer into the negative and again, experience some of those thought traps. So thinking along the lines of, I'm not a good parent. I'll never know what I'm doing. I can't do anything to help my child. I can't seem to get it right. And then thinking negatively about your kids, losing that perspective of all of the things that have gone right with your parenting and with your family, and feeling like their OCD or anxiety is sort of taking over your image of them. So thinking, my child's never going to get better. They'll never be able to accomplish XYZ, and even having some grief around where you imagined your child might be at a certain point, or um, how they're how happy they might be, or how happy and easy family life might have been in your mind, maybe before having kids or before realizing what they are dealing with. That can be really tough too. An increase in challenging behaviors from kids is actually pretty common when parents are stressed. So, this isn't a conscious thing on your kids' part, but they are really adept at sensing when something is off with parents. That is a survival strategy their brains and bodies have, is to be really attuned to how we're doing. And when parents are stressed, often we see bigger behaviors from kids. So in younger kids, that might look like more tantrums, and older kids, maybe more testing of the boundaries, pushing the limits, trying to engage parents for negative attention. This is common, and of course tends to make parents even more stressed. It can impact your work and your social life outside the home too when you're very stressed. And it can also increase your own chances of experiencing a mental health concern. So you yourself might end up feeling anxiety, depression. If you, as a parent, have been diagnosed with OCD, you might find that your OCD symptoms are harder to manage, even if they've been under control for a while, because of what you're managing as a parent. And then there is this really tough cycle of stress that happens where kids have a lot of needs, which cause stress for the parents, and then kids become stressed, and then parents become more stressed, and so on, and get really stuck in that cycle of too much stress. So, some common challenges I really want to validate and normalize for those of you watching that do have kids with anxiety or OCD. You may have gone through frustration or confusion around your child's diagnosis. So, getting them diagnosed in the first place, finding the right provider, a provider who understands anxiety and OCD. Your child may have been misdiagnosed before, and you may have had to do a lot of advocating for your child in the school system, the medical system, mental health care, to get your child what they need. And that is really wearing on parents. You may have guilt or experience helplessness once you know what is going on with your child. So, a lot of parents ask questions like, did I cause this? Did something that I did with my parenting style lead to my child going through what they're going through? Is there something genetic? Maybe there's a history of mental health challenges in your family. So, am I responsible for how my child is doing right now? And also feeling helpless, like maybe this isn't something you were familiar with at all, and you're not sure what to do, or you feel like you've tried a lot and things haven't improved the way you want them to yet. Feeling like you're just not sure what to do next. Those are really common experiences. Having kids who are going through anxiety and OCD treatment can be really tough for them as well as their caregivers. And those emotions are hard, but really common too. Then being engaged, very literally engaged in your child's OCD or anxiety related behaviors. So you may notice that your day-to-day routine has shifted because of some accommodating that your child's OCD and anxiety have sort of roped you into. Those diagnoses do tend to pull people in, especially parents. If your child is anxious, they may seek a lot of reassurance over and over. And if your child has OCD, they may have rituals that now involve you and what you do. They may even have rituals around your own behaviors separate from what they do themselves. And this can be stressful. And oftentimes it starts out really well intentioned on parents' parts. They're just trying to support their kids, keep their kids' anxiety levels down, provide their child with some relief and some kindness. And then it becomes this ongoing thing that your child is sort of seeking from you because of their OCD and anxiety really taking over. Struggling as a parent to balance setting appropriate boundaries with being warm and caring. For some parents, setting appropriate boundaries can feel really unkind or harsh because it leads to really big emotional responses from their kids. So when you try to resist overly reassuring your anxious child, they may get more anxious in the moment, or they might be tearful. They might be angry with you. Same thing with resisting participating in your child's OCD rituals. It might lead to a really big emotional response, which for some parents can feel like they're doing the wrong thing, like they're being unkind, when actually they're doing something with their child's long-term well-being in mind. And then finally, a sense of isolation. So, if you don't have a community of other parents whose kids have gone through mental health challenges, or maybe you do, but not anxiety or OCD, it can feel like no one understands. Like it's hard to relate to other parents because your experience is so specific. It can feel really isolating. Like, is any other parent going through what I'm going through? Does anybody really get it? Okay, so with those signs of stress in mind and those particular challenges in mind, let's talk about some coping strategies. And keep in mind, this is not an exhaustive list by any means. There is a lot more to be done to address your child's anxiety and OCD symptoms. These are more some brief coping strategies I wanted to go over, really focused on parents addressing their own stress. And there is way more out there. But with our limited amount of time today, I wanted to just introduce a few. So, in general, for parents navigating life with a child who has OCD or anxiety, it may be necessary to adjust expectations. When our expectations are off kilter for what our kids are capable of because of where they are in the moment, maybe where their treatment is, how severe their symptoms are, it can add a lot of extra stress. So adjusting those expectations, not for the long term, not thinking, oh, my child will never accomplish XYZ, but just thinking, okay, in the short term, I need to adjust what progress looks like, what success looks like. Because otherwise we're setting ourselves up for a lot of disappointment and frustration and some of those negative perceptions of ourselves and our kids that maybe just aren't a reflection of, again, where they are in that time and place, but is also not likely to be forever. So instead, we can focus on the immediate priorities without giving up hope. So, for example, maybe an immediate priority is addressing a ritual around your child's sleep so that they can get a good night's rest, and so can you. And then thinking about, improving their grades, getting those straight A's later. It doesn't mean that we let go of the idea of their academic success, just as an example, forever. But it means for that moment, thinking about what is the first step that I want to take? What is the most important thing to my family's well-being right now to facilitate some of those longer term goals rather than holding everything at once? Celebrating small wins. This one is so important for parents as well as kids because parents can be so hard on themselves and kids can too. and acknowledging those small steps that kids and families make together to get better, to live better lives, is so important. It's really good modeling for kids who are anxious or have OCD. And it's also important for our brains as parents to really learn to focus on what's going well rather than what could be going better or what was unsuccessful. Recognizing the difference between accommodating a child's anxiety or OCD versus being a supportive parent. So, if you are here, it is because you want to do the best for your child. You want to be the best parent you can be. You want their OCD and anxiety symptoms to get better, and really differentiating what is inadvertently feeding those symptoms versus supporting your child as a person is so important. And sometimes it does take working with a mental health professional to figure out where those lines are because they can be really blurry, especially in the moment when you have a dysregulated child on your hands and you want to do right by them. And then keeping the overall arc of progress in mind. So it is normal for kids with anxiety and OCD to have really tough days, tough weeks, tough months sometimes, especially given everything that families manage, school, work, extended family stressors, friends. There's so much in life that can make anxiety and OCD symptoms harder that are out of our control. So, trying to keep in mind the longer term arc of progress, especially if your child is newer to treatment, it might take some time for things to get better. So, thinking about where you started, maybe before you even had a diagnosis, to wherever you are in the process now, chances are in the arc of progress, you are moving forward, but it can be tough to really internalize that and recognize that when you're in the thick of a really stressful time. And then finally, engage in your child's treatment. So, whatever support they are receiving, whether it's individual therapy, group therapy, medication management, meetings with a school counselor, whatever it might be, your engagement will not only make it more likely for them to get better faster and for the improvement to stick long term, but it's also really good for your own stress, for you to feel empowered and informed, to have tools that you can use at home, tools and strategies to use at home to really reinforce the progress that's going on with your child's treatment. And also, again, for your brain to have the opportunity to take in all of those wins, all of the progress that your child is making is related to the supports that you have enabled them to access and the advocating that you've done for your child. So, really having a chance to see that parental success for yourself is so important. To decrease your stress long term, these are just a few ideas. Again, by no means is it an exhaustive list, but a few things to think about. If you get overwhelmed just at the idea of taking steps to de stress, which some people absolutely do, remember to focus on the essentials first. If nothing else, trying to improve your sleep, your nutrition, and or your movement, getting your body going. If nothing else, those are sort of the pillars of our well-being. And if it sounds just like too much to incorporate anything else, start there. Once that is in place, that foundation, we really encourage gratitude practices. So, not just being grateful here and there in the moment, but really establishing something that you do every day. Research shows that this literally changes how our brain thinks. So, gratitude practices are really effective for boosting our mood and lowering our levels of stress. This can look like one line in a journal every day, or maybe in the notes app on your phone. You could get a buddy involved and text a friend one thing that you're grateful for every day, or send them a quick little voice note. It can be really fast. I definitely encourage an accountability partner, whether it's a spouse, a friend, a neighbor, even your kids could do this with you, maybe if they're open to it. but it has to be established as a consistent practice to be effective. So that's why this one is more long-term, a longer-term commitment. I'm alone with other adults. So consistently having a space, even if it's once in a while, where you can be with a friend or a partner. And maybe even if you're comfortable with it, having it be a designated OCD and anxiety break where you can vent about other stressors in your life, but feel like your child's anxiety and OCD are not the forefront of everything. So give yourself some time and space to process positive things in your life, even other stressors, things that are really personal to you, and set aside your child's anxiety and OCD symptoms because that takes up so much of your life as it is. Engage with parents who can relate. So this could be an online group, maybe locally connecting with parents whose kids have anxiety or OCD. It's a really unique experience. And again, it can lead to a lot of isolation. So hearing from parents who can not only offer a lot of empathy, but who might be able to share some tips, some success stories, can be really encouraging and open your mind to the possibilities and give you some new ideas too when you're feeling too burnt out to generate them yourself. And then, of course, getting your own professional support. We understand that sometimes it's not feasible for kids and parents to be involved in their own weekly therapies. But maybe if your child's in weekly therapy and you can manage every other week or even once a month, or maybe group therapy rather than individual therapy, having your own professional support is likely to really bolster your child's own treatment, because the better your mental health is, the better their mental health will be. And it really is so important to your long-term health as well as your family's functioning. A few strategies for relief in the moment, because we all get dysregulated on our own and in front of our kids. And it makes it really tough to parent as we want to when we are losing it. So a few things to try, and these aren't going to be for everyone. These might not all be for you, but just things to experiment with and see if they help with your stress. Just naming the emotion, especially if it's anxiety, that can be helpful modeling for your kids. And if you're not comfortable naming it out loud at first, you could just name it to yourself, but acknowledging, I am really angry right now. This situation is making me so frustrated. I can tell that anxiety is taking over in this moment. Those kinds of things, just putting a label to what's going on, recognizing that it's not you, your core self forever, but it is an emotional state that you are in that will pass, is really helpful. And it can also just sort of slow down your system from having those racing thoughts, or maybe losing your patience, acting in a way that you are not going to be happy with later. Acknowledging and getting comfortable with a big range of feelings. So this is really important if your child has anxiety or OCD, because as they are engaging in treatment and getting better, they are going to be challenged. They will be uncomfortable sometimes so that they can thrive in the long term. The short term might look really tough for them. And if you, whether you're typically an anxious parent or not, are understandably dysregulated when your child is in that really heightened emotional state, then that's something that you want to pay attention to so that you can really keep your own system calm in those moments and not have that be an additional stressor. Self-compassion phrases are great. So talking to yourself, whether silently or out loud, as you would a friend, can be, again, not only soothing for your system, but great modeling for your kids. So saying things like, this moment is temporary. I'm doing my best with what I have. Things will get better. They're just really hard right now. Really validating and bringing a lot of warmth and empathy towards yourself is great for decreasing stress. And make sure that it's authentic to you. You know, it doesn't have to be pre-scripted, but really tuning into what sounds like a genuine, kind internal voice. And sometimes that takes practice. For kind of a more physical, concrete thing to do, splashing some cold water on your face or putting an ice pack on your face can actually slow your heart rate and help you take deeper breaths. So if you experience your stress really acutely in your body, this can be just a quick tip for settling a bit. And then breathing exercises are very popular, taking 10 deep breaths, counting to 20 before taking your next action. Let your system again slow down a bit. This isn't for everybody, but some people find deep breathing really useful in the moment. And again, something that you can demonstrate as a tool for your kids to use too. I want to mention a few resources. So, of course, Austin Anxiety and OCD specialists would love to have you. We have an office in Westlake, in Allendale, and in Round Rock. You can give us a call, check out our website, or email us. We have individual therapy available for kids, teens, and adults, as well as some group therapy and some intensive outpatient programs. Here are a few books we recommend checking out if your child has anxiety or OCD. Lingering in case you want to take a screenshot or jot them down. And then these are a few references from this presentation. The International OCD Foundation can be a great resource. They have some articles for parents. A lot of this content was inspired by one of our therapists on our team and the manager of our IOP program, Samantha. She is fantastic. And the treatmyocd.com website also has some resources that could be useful for parents. So feel free to check any of those out. Thank you so much for your time today, for checking in and taking steps to take care of yourself so that your kids and your whole family can thrive. We wish you the best, and thank you so much for listening and for being here. Bye.